Hey guys, it's Dr. Truesdale, and today we're going to dive into Ozempic Face. Everything you need to know about this medication. Does it really make you age faster? Let's dive in. So I'm a double board certified facial plastic surgeon, and so I think about the face a lot. One thing that I see a lot, every single day, people walk into my office and they say, "Hey doc, I'm looking older. I want to do something about that." I then break it down into, well, why do you look older? The two main things that happen as we age is we lose volume, or volume changes and shifts around, the skin itself changes, and things fall down. Ozempic face has been a term that's been discussed in social media, and it's really become quite a popular topic when people are talking about plastic surgery. And the reason why is people are noticing after the use of this medication, they might look a little bit older. Now, why might that be? Let's first talk about what semaglutide is and what are all these medications and why they might affect your face. So semaglutide or Ozempic, Wegovy, tirzepatide, all of these medications are GLP-1 agonists. Whoa, doc, you said GLP-1 agonists? What does that mean? Well, these are a classification of drugs that were originally used for diabetes control, so people who have elevated blood sugars. And we found as a kind of a side effect of treating patients with these that they were actually having weight loss. And the reason for that is these medications do a few things. One, they increase the insulin release in a glucose-dependent manner, and that actually helps your body release and mobilize stores of sugar. It also decreases the release of glucagon, which is the enzyme or the hormone that says hold on to fat, hold on to sugar. It also prolongs gastric emptying, so it keeps food in your stomach a little bit longer. It also has receptors in the brain. It actually makes you a little bit less hungry. Receptors all across the body. The end effect of all of these special things is it makes you consume less calories. And if you consume less calories and you still burn calories, then you will lose weight. Now, that alone is actually very helpful, and people have had a lot of benefit being on these medications. But there's a downside too. People have found that if you lose so much weight so quickly, you'll actually end up getting facial wasting. And so when people are discussing what is Ozempic face, what they're talking about is the unintended consequence of facial aging and volume loss in the face related to the use of these medications. In my office, patients actually get this medication, and it's important to counsel every single patient about safe weight loss. Safe weight loss is a weight loss that is not too rapid. The reason why I'm bringing up how fast you lose weight is if you lose weight very quickly, there are facial stores or fat stores in your face and across your body. And if that volume goes away very quickly, elastin and the skin itself, the stretchy kind of elastic part of the skin, can't compensate and shrink wrap down. So as that volume goes away of the fat, the skin can't adjust. And so you end up getting fallen skin, loose muscle, and it just doesn't look very good. So if you are on one of these medications, it's very important to do the weight loss in a controlled manner, because if you lose weight too quickly, one, you're putting yourself at risk for Ozempic face, and number two, you actually can lose too much muscle. So losing weight very quickly actually puts the body in such a caloric deficit that it starts using and tapping protein as an energy source. And that can make people weak. And research has shown recently that people with chronic diseases who are losing weight rapidly, it has the benefit of helping them with their blood sugar and other cardiovascular benefits. But if they're losing too much muscle, that can affect your strength, that can affect your heart and other aspects of your health. Everything in life is about balance. So Ozempic, semaglutide, Wegovy, tirzepatide, all these medications can be used safely for weight loss, but it really should be done not too quickly because the skin can't reconstitute itself. Now, one question that people always ask is, hey doc, the fat that's in my face, is Ozempic specifically targeting that fat? No. So the good news is Ozempic isn't necessarily targeting the fat in the face, but the face unlike other parts of the body, is very receptive to changes. And because we communicate with the world using our faces, seeing that volume loss in the face can actually dramatically make people look older. So is Ozempic face real? Absolutely. So now that we know a little bit about Ozempic face, what can we do about Ozempic face? The first thing is we could try to prevent it. But say you do have Ozempic face, we need to restore the volume. There are a couple of ways that we can restore the volume in the face. Number one, we can add fillers to the face. There are different types of fillers, and you can definitely check this link here where I discuss more about fillers. Fillers come in permanent fillers as well as hyaluronic acid type fillers, and we can, in the office, in mere minutes, restore volume back to a face and make that face look years younger. That needs an artistic eye, and it takes a very skilled injector, but that is one option. Unlike other types of fillers, these fillers are not permanent. So if you want something a little bit more permanent, the other option is fat transfer. I love fat transfer because we're replacing the thing that you've actually lost. So it looks very natural and it can look very, very good. The other benefits is when you're doing fat transfer, you're actually stimulating growth and rejuvenation because there are stem cells that go along with the fat that actually I see in some of my patients, their skin looks wonderful. And so you're getting benefits with the skin and the soft tissue. So that's something that you can consider. Now, if Ozempic face or the rapid weight loss in the face has been very, very dramatic, sometimes adding volume is just not going to do it, okay? Sometimes we need to actually lift the face. So I have several patients, here's one, who actually talked about rapid weight loss and how that affects their face. Look at them after I added some fat and after I lifted their face, they look worlds better. And so sometimes lift and fat need to go together because both of those things are coming into play as we age. So if you're interested, or say you have actually experienced Ozempic face or rapid weight loss, or things are looking a little loose, learn more these videos here, or maybe reach out to my office because I'm sure we can help you. Hopefully you've learned a little bit about Ozempic and Ozempic face, what to do about it, and different treatment options. I'll see you soon, guys.